We're all so busy living our lives. And then suddenly something cuts through that, something often very unexpected.
Pediatric trauma call, 15 minutes.
A 71-year-old female with 2 stab wounds to the back.
He was found to be in traumatic cardiac arrest.
I can't feel any pulses. We're at St George's Hospital in Tooting.
Yeah, 24 hours, 7 days a week. I love that question. What's your opening hours?
St George's, London. One of Britain's busiest A&E departments, under more pressure than ever.
So do you want to watch, darling, or do you want to look away?
This is the worst day ever. You never know what's coming in, and you just have to be ready for anything.
Gas canisters exploded, 15% burns to hands, face.
In a world of uncertainty, we see a life-changing event.
I'm at A&E, I need her to get out of here, please.
When patients come in, something takes over.
I'll be fine. I'm going to be very fine.
A place where life,
Give me an A, give me an E.
love,
Okay, good lad, well done.
and loss unfold every single day.
Did you enjoy the Queen's birthday yesterday?
I watched the football.
All the patients you're about to see were treated in just one 24-hour period.
Don't worry.
We get to see people who love one another in loads of different ways. Yes. And I think you can give someone the best care in the world, but really what they want is to hold the hand of the person that they love and for them to tell them that they're going to be okay.
You're my hero.
I'm going to work without a radio. Where does it go anyway? Someone smells fresh. Not me. Yeah, it's not me.
I would really like my lunch. I haven't had my lunch yet. I haven't had breakfast yet.
Working in resus today is consultant Will.
So, let's add some x-rays to him. People often say that when they go into medical school that their motivation is that they want to care for people, but for me it started with being inquisitive. What does that look like?
I don't know.
So does that not look like an acute ST elevation MI?
I don't know.
Different specialties attract different types of personalities. I certainly enjoy the sort of immediacy and the fast pace involved with emergency medicine. There's no surgical pathology. The swelling should not affect her airway. And it wasn't until I understood more about what being a doctor entailed and actually how much more important that human aspect is. The responsibility of what you're being trusted with becomes apparent to you. What's brought you to see us today? Don't stay in ambulance. Pop this hand up for me. That gives you a certain perspective about what's really important, and it's not having a big house or a nice car. Get you sorted, sir. It's about being happy with your lot. And it certainly does affect how much you cherish what you've got when you've got it.
Hello, St George's ED. Okay, go ahead. Yeah. Thank you. Bye. Adult male trauma call, 20 minutes.
An 84-year-old man is being rushed to A&E after losing control of his car and crashing into a road sign.
When you get a trauma call, one of the pieces of information you'll be given is the age. If you've got a patient in advanced years who's been involved in a high-speed traffic collision, you're automatically thinking you may well have somebody who's critically injured.
Although the airbag went off, he still made the bullseye of the windscreen, even though he was wearing a seatbelt.
If somebody's bullseyed a windscreen, One of the concerns there is that that patient has a significant head injury.
The man's wife has been informed and is on her way to St George's from Surrey.
I'd gone out with the WI for a meal. We were almost at the end of our meal when I was asked to go to the desk to see somebody, and the somebody was this police officer. I just thought, oh my goodness, what's happened? And then she said it was John. And then she said he's had a very nasty car accident. All sorts of things go through your mind, because you just don't know what to think.
All right, ready, steady, roll.
Is that your knee, John, or is it your chest?
Can you reconnect? Get a collar on there first.
Steady.
Let's get you sorted out.
Brilliant. So this is 84-year-old John who was involved in an RTC. He was a driver in a car. He had a seatbelt worn and both airbags are deployed, and there's a significant bullseye on the windscreen. He has bruising to the left side of his chest and to his abdomen. Is there anything else that you'd like to know?
Elderly patients have less ability to deal with a given injury than a much younger patient. Your ability to deal with blood loss is lessened. Your bones become less supple.
All right, nice deep breath for me, John.
Injuries that would be relatively minor could end up being really quite severe and life-threatening, and you need to take action very quickly.
We'll get you some painkillers in a moment.
84-year-old John has been brought for an urgent CT scan after losing control of his car and crashing into a signpost.
So you just have to lay nice and still as you are, okay?
Yeah, okay.
All right. So we'll start off, we're just going to scan your head and neck, okay?
John's wife Gwyneth and daughter Susan have arrived from Surrey.
Okay, so nice and still now.
We knew each other from the time we were about 11 and 13. We were in the youth club together and all sorts of things, playing table tennis and going on hikes. We were sort of pals for a long time. He was tall. He was 6'4", and I liked tall men, you see, so that was good. And he was always in with a group of friends, and you know, they thought we were going to get married eventually. I said, no, we're just friends. He was then doing his national service for 2 years in the Navy. And he was lucky enough to be on boats. He was on aircraft carriers and things. So he was away a lot. It was very difficult because we hadn't been apart that much at all. No, I suppose that was when it really struck home. I missed him a lot more than I'd realised before. One day, my brother said, you've got a phone call, and I said, a phone call? And then over the phone came John's voice, and I said, what are you phoning me for? He said, well, I've got the opportunity of using the landline that's being laid, and I thought I could phone you. I said, real romantic it was. I thought I'd phone you.
Doctors will need to wait for the initial results of John's CT scan before they can determine the full extent of the injuries to his neck, spine and internal organs.
hope they let me in to watch it.
Watch what?
Them do whatever they've got to do.
And why would you want to do that?
Just tell them that you want me to come in.
No, I don't.
No, honestly, you do.
No, I don't.
Just say you'd feel more relaxed if I was there with you.
But I won't.
You will.
I bloody won't. Oh, God. Jenny, the slightest touch is hurting me.
Don't be a baby.
No, I'm touching it there. From my jeans, it still hurts.
Yeah, it will hurt.
How do you know? You got one?
No, but I know that something...
How do you know?
Because I know that something...
It's like me saying I know what it's like when you give birth. I don't never know.
It's because it's large.
Is it?
Listen to the ZD. Okay, go ahead. Yeah. Thank you. Bye.
A 66-year-old supermarket assistant is being brought to A&E after suffering stroke-like symptoms on her way to work.
Adult thrombolysis call 20 minutes.
Her husband, Paul, called the ambulance.
I was on quite a late shift the night before. What we normally do then, I'll just stay out of her way while she gets ready for work. She said, I don't really feel that well. But Christine has always been a trooper. She'd do her best to get into work. But I heard her come back in again, so I got out of bed straight away. She said she got halfway to the bus stop to catch the first K3 to Isha to try and get the Waitrose where she worked. When she collapsed and had to support herself on a wall, she said, Paul, I don't feel right at all. I've never known anything like this before. The whole of my left side's gone.
Due to the immediate onset of her symptoms, specialist neurology registrar Anil has been called to resus.
It's sudden. One moment you're functioning normally, and just suddenly you can cruelly have the loss of the ability to do some things we really take for granted.
Good morning. I'm Lizette. I'm one of the stroke team members.
Okay. So Christine woke up at 5 o'clock this morning. That's normal for her. She was getting dressed for work and noticed that her left arm was a little bit numb.
Can you say tip-top for me?
Tip-top.
Huckleberry fin?
Huckleberry fin.
But you think the left leg is numb as well?
She did say when she was walking, she was definitely drifting to the left side and having to use the wall to prop herself up.
Fine. Hi, morning, Christine.
Good morning.
So I'm just trying to do a few tests, basically, to try and assess whether you've had a stroke or not.
Okay.
What month are we in?
We're in June because it's my son's birthday tomorrow.
It's your son's birthday tomorrow.
Yeah.
Brilliant. And just with your eyes, follow my finger. Do you get any double vision?
No.
Good. All right. Can you cover your left eye?
The brain is a very specialised organ, so there are elements which control movement.
Okay, can you put both your hands out, straight out, palms up, keep your hands there. It's quite shaky, isn't it?
Yeah, it is, and that leg's shaky as well.
Tremors can be a sign of a number of different things. Does it most look like a stroke, or does it have the feel of something else?
Just with this index finger, touch my finger. Now touch your nose. Finger, nose. Okay? Okay, now the same thing on the other side. Okay, that's much harder, isn't it?
Christine needs an urgent brain scan. to determine what may have caused the sudden weakness in the left side of her body. Only then will doctors be able to decide on the next stage of her treatment.
Imagine you'll get a few football injuries, will you?
No, we haven't had any yet, actually. I expect as England progress in the tournament, we'll get more injuries.
Yeah.
My sort of pinky finger got mixed up within the shorts and I could sort of feel it pull.
Ow.
7-year-old Reggie has come to A&E with his mum Hayley and brother Alfie. He hurt his arm doing a cartwheel to celebrate England's win against Wales in the European Championship.
He doesn't like England anymore because they made him hurt his arm. I'm sure you'll like them again soon.
No, never.
You'll never like England again, okay? Oh, hi, I'm Marion, one of the doctors. You've hurt your arm?
Yes.
So what happens? As he went on the floor and put weight on it, I think it just popped out, yeah.
Right. Okay. When I'm pressing here, does it hurt here?
A tiny bit.
This side, sorry. Okay, I'm not going to move it anymore. It's definitely not in place in terms of you can see the alignment, but I don't want to manipulate it because it's going to be too painful for him. So we'll just x-ray his arm to see what injuries has had to it.
I've always been all about children from a really young age. I used to worry my mum sometimes, at like sort of 8 or 9. I just want to be a mum. My mum would say, there's a lot of things you need to do before that happens.
I always wanted to see inside Reggie's body.
Like some of my friends at school kind of had these career plans to be journalists and doctors and dentists. I just want to meet someone and have babies.
I find out to speak to Daddy.
You want to speak to Daddy?
Yeah.
I was 17 when I met Rob.
I've got no reception bell, but it might not work.
I was like, oh my God, he's amazing.
They might put you to sleep to do something so that you don't know, it doesn't hurt you, yeah? Okay? Right?
Yes.
Good boy.
It was probably only a few months into the relationship that I would start talking about children and Rob would go, no, stop talking. We were together for 4 years and we bought our first home. And then I kind of notched it up a little bit, like, oh, now there's like really no reason that we can't have children. And yeah, and then a year later, Reggie came along.
Mummy.
What's wrong?
I love you.
I love you more.
I want a kiss.
Kiss. Good boy.
I'm going to come and be a semi-porter until I can find one.
Okay.
Reggie will be taken to X-ray to assess whether the impact has caused a fracture to his arm or shoulder.
Mum,
Yeah.
it looks like cyborg.
It looks like what?
Cyborg.
Doctors are still awaiting the initial results of 84-year-old John's CT scan after he lost control of his car and was thrown headfirst into the windscreen.
When he'd come out of doing his national service, I think he thought, I've got to get something sorted out here. But my mother was very sick. He asked me if I'd marry him. He asked me 3 times, and each time I said, I don't think so, because I thought I can't marry him and leave my mother. And he was ever so kind and helpful to her. If she wanted anything done, John would be there, sort of with a hammer and nails or whatever. And no, she was very fond of him. And then one day she realised what was in the back of my mind and said, look, you've got to get married if that's what you want. Don't think about me, sort of thing. So we went out for a meal and that was it. He'd got a ring and I came home with the ring on, you see.
Consultant Will has received the initial results of John's CT scan. They show a fracture to his pelvis and serious internal bleeding.
Pelvic fracture is a very serious injury. it's quite a significant structure. It's also got a very, very rich blood supply around it. And he currently has a systolic blood pressure of 60, as white as a sheet. You can have a situation where you injure an artery deep inside somebody's pelvis and it will just bleed away. But I think all of this, if he's smashed his systolic, is the culprit. So we're going to do a code red. We want blood.
John needs an emergency blood transfusion to prevent his heart from going into cardiac arrest. It's been just over 20 minutes since 66-year-old supermarket worker Christine arrived in A&E after losing control of the left side of her body.
Are you clear that you had the symptoms when you woke up?
Well, not as soon as I woke up, but as soon as I made an attempt to get out of bed.
Okay, fine.
Doctors suspect that a growth or blood clot may be affecting her movement.
Careful.
The brain is something which is still, in some ways, a mystery. It's still, out of the organs in the body, probably the one we understand the least.
She's very shaky like that, isn't she?
Christine's husband, Paul, is awaiting an update on her condition.
I used to play a lot of football. I got to know Chris because she was working behind the bar at the club. I was only 21 then. She had long, dark hair, short black miniskirt, nice legs, and I was shy. I probably had a few drinks, so that's when I asked her out. She had a bubbly personality, life and soul of the party. You know, she could talk to anyone. That's what attracted me to her. She had good social skills and things like that, you know, which I was lacking and still lack.
Breathe in and hold your breath.
We got married in March 1975. I don't remember actually proposing. I think she went to see the priest and arranged it all and then came back and told me. I just went along with it. Yeah, it's great times, happy times.
Thank you very much.
Doctors will now need to wait for the full results of Christine's CT scan before they'll know what's caused the weakness in her left arm and leg.
When I got out of bed, I knew there was something wrong.
I don't want to go to school tomorrow.
You don't? Why not?
I think I'll leave it for a few days and then go back.
If you go to school tomorrow, you get to wear your own clothes.
Doctors have received the results of 7-year-old Reggie's X-ray after he injured his arm doing a cartwheel to celebrate England's victory against Wales.
Oh.
Right, we've got the X-ray back. And it is broken.
Right.
And it's moved out of place.
Okay.
So I've spoken to the bone doctors. They want it casted until they come and see him and see what happens. I don't know if you wanted to see it.
I want to see it.
Do you want to see it?
Mummy.
I think when you have your own children, you always kind of reflect on how you was brought up. Okay, it's okay. My childhood, it was a pretty normal South London upbringing. Mum and Dad were together at first, but then Mum and Dad separated when I was 14. It was hard because me and my sister were both daddy's girls. It changed the relationship that he wasn't there every day. We never really spoke about it. It was happening and we just dealt with it, and this is the way it's going to be from now on. Like a protection thing, probably. Don't speak, it's not actually going on.
Reggie's arm will need to be bandaged before orthopaedic doctors can decide on the next stage of his treatment.
Deep breaths, deep breaths, deep breaths.
This is the worst day ever.
Babe, I promise you, they're going to fix it and it will be fine. I promise.
"84-year-old John has been given an emergency blood transfusion, whilst doctors attempt to stop the bleeding from his fractured pelvis.
Is all the feeling normal here down the chest?
Very tender.
Dr. Will has referred him to orthopaedics to decide whether or not they should operate on his left hip.
We are medically managing his bleeding. We have a period of stability at the moment, so it might be that he's bled but is no longer bleeding. So we're trying to come up with a plan. Patients with pelvic fractures, there is a risk that any movement could worsen the bleeding. Patients who are elderly will have a harder time coping with any surgery they require to fix that. It's not something that can be done completely without risk. Plan A is that we're going to take that risk and we're going to do it.
Do you want to come through and see him?
I'd love to.
So just to warn you, he's a bit beaten up, okay? John, your family are here, sweetheart. Your wife's here, okay?
I suddenly lost control of the car. I don't know whether the road was wet or what it was.
Oh, I'm sorry, John.
You don't have to apologise to me, no.
I'm just very, very sad that you got this all to contend with. 2 years ago, he got a sort of a niggling cough. And I said, why don't you go and see the doctor, because this is a bit strange, this is, you know, keeps on. And so he went and saw the doctor, who referred him to the Marsden. Having been sent to the Marsden, you know that things aren't as they should be. And they picked up this lung cancer.
You're going to be sporting a very nice bruise on that head.
He's got it in both lungs, actually, but one lung particularly. And they said, we can't actually operate and we can't cure it, but we can give you palliative care. He's had chemo, and then he had 6 weeks of radiotherapy. I was really worried for him.
How's the pain, John?
Where are you from, dear?
I'm from Italy.
You're Italiano?
Yeah.
Oh. Parliamo Italiano. Sì.
Oh, there you are, John. You've got a lovely nurse giving you dabs on your lips. Oh. No, you can't swallow it, you just got to...
Yeah, a little bit, just a little bit.
Try, you sort of...
You got any grappa?
Tell you.
I wish. I wish to have some grappa at this point.
Orthopaedic doctors have arrived to discuss surgery with John.
John, can I chat to you about your hip on the left? Yeah. The hip is dislocated and it's fractured in many places.
Really?
Yeah, so in order to reconstruct the hip joint, okay? If we do this procedure, it enables you to walk again, okay? Without it, you won't be able to walk, all right? I don't want to worry you, but there's a very small chance that if there's lots and lots and lots of bleeding from the pelvis during the surgery and we're not able to stop it, eventually that you could bleed to death from this injury. You know, it's a big surgery, basically.
Yeah.
Okay.
Yeah. Okay.
All right.
Yeah.
I think for every patient you see, you have an idea of what the consequences might be if you have a bad outcome for that family unit. I think there's extra considerations with really elderly couples, as often the death of one partner can have some very significant consequences on the remaining partner.
Oh, I'm sorry you've been like this. Because he was somebody who was there for me, I felt I wanted to be there for him. I don't really think I'd known anybody else that I could rely on who could get me over the humps when I needed to get over the humps, you know, with my mother being ill. I'll be in touch tomorrow morning, see how things are, okay? I've never really thought about life without him. He's always, you know, always been there. But then we've always been a partnership, John and I, so, you know, it's, we've sort of shared everything pretty well.
John will be taken to intensive care ahead of emergency surgery to his hip and pelvis to give him the best chance of walking again. Doctors are awaiting the results of Christine's CT scan after her left leg gave way whilst travelling to work at a local supermarket.
We made up our minds at an early stage to have 3 children. I was over the moon with our first baby, Sharon, come along, and the midwife handed her to me. We was ecstatic. When my dad came in and saw Sharon, he kept saying, "Cor, what a cracker, what a cracker." At the time when the kids were young, I was working usually 7 days a week. I was like a semi-skilled engineer. It was actually the ready brick factory I worked in, and maintaining the rollers and the machines that produced ready brick. Chris, for quite a while, didn't have to work. You know, she'd just concentrate on looking after the children. But then the factories closed down and I got made redundant. And it did knock me confidence, you know. It's difficult getting another job that paid that well. We sat down and worked out our outgoings, and we felt that the only way things could work out is if she went back to work full time. That kind of broke my heart because Sharon was still quite young. I remember tears running down my cheeks when I dropped her off with a baby minder, because I just wanted us two to take care of the kids, but we had no choice then. That's typical Chris. Any problems that's come up, she's always really listened, so we get through it.
I was alert enough to phone up work this morning to tell him I wasn't feeling well and I wouldn't be coming in. So, you know, at least I didn't black out or anything. So that's a good sign, isn't it? I keep convincing myself. I was born in Waterford, Ireland. There was mum, dad, and I had 5 sisters and 5 brothers. My dad was a pig farmer. I used to get up at 6 in the morning, go out and pull the hay on a frosty morning. Your hands would be falling off you. We had no running water, so we used to have to go to the well to get the water. And on a Saturday, that was our job. We'd have to get loads and loads of water so Mum could do the washing. She scrubbed them on one of those washboard things. Really old-fashioned ways, but that's the way they done it in them days.
I hope you don't mind me putting this by the earlobe.
No,
At least it's out of our way there.
I knew I wouldn't stay in Ireland. But in my time, there was no work there at all. You know, much as I loved it, there was nothing there.
There you go.
I was 16 when I came to London. I came over in 1966. I had a pair of bell-bottom jeans on, and I had white plimsolls, white socks, and a T-shirt. And I was in fashion then. And I got such a shock when I went into Paddington Station with everybody on top of cars, people sitting on the side of the road, drunk and happy. And I thought, where have I come to? It was the next day I found out really what was going on, because I didn't know that night at all. England had just won the World Cup, the one and only time. And I was going to turn around and go back home again, but I thought, well, I like this.
I'll be back, my lovely.
Yeah. And I think leaving home when I was so young made me realise, you know, you have to fight or else you fall, don't you? So So, and I wasn't going to fall, and I never will fall.
She had a contrast CT as well?
Yeah. But it doesn't enhance.
Dr. Anil has received the initial results of Christine's CT scan. They show an area of swelling on her brain.
Seeing a swelling on the brain, you know, I guess, what it can be. And certainly a brain tumour can be on that list.
It's going between ACA and MCA.
But you need to be sure. You need definitive evidence before you sort of tell somebody something which is going to potentially change their life forever.
Now check your fingers. So with your thumb, can you bend the tip? Good, and make it straight.
Orthopaedic doctors have arrived to assess the severity of the break in 7-year-old Reggie's arm.
So the way he broke his arm, if it healed, it would leave him with a deformity and poor function in the arm. So if we bring him to theatre tomorrow, he needs surgery to align the bones and then to hold them there for at least 4 weeks. Okay. That's how long his body will take to heal it.
Okay.
Any questions?
No, I don't think so. My head's all over the place.
When you're a mum, you kind of have to spin all the plates at the same time. I would much rather take on all the stress of any situation myself than cause anyone else stress. I kind of want to be Superwoman and deal with everything.
No need to be sad.
Worried about Reggie.
I promise you, you don't need to worry about Reggie.
I think the way I was brought up made me quite reserved. Rob moans at me and he's like, you don't talk enough to anyone. I'm like, well, that's just how I've kind of learnt to be.
Take your coat off. Look, your brother. Come here.
But because I know that's a bad trait in myself, I want to make sure that that's not passed on to my children. So I really encourage them to talk to me about anything.
Look, you're feeling better now, aren't you? See? It's going to be absolutely fine. You can stay at Sarah's house tonight, and then she's going to drop you back to me in the morning. Okay? Okay?
Reggie's the best brother in the whole wide world.
Both are good brothers.
You need to show your feelings and how much you love people because they're your family.
Reggie will be taken to a pediatric ward ahead of surgery to align the bones and fix the break in his arm. It's been just over 40 minutes since 66-year-old Christine arrived in A&E with stroke-like symptoms. Her CT scan has revealed an area of swelling on her brain that doctors suspect may be a tumour.
We'll talk to the neurosurgeons, then see what they say. Hi there. Just to give you a quick update then, so you take a seat. So essentially, we've seen some changes on the CT scan which don't fit with a stroke. So it looks like that could be something different.
All right.
We need to do some further investigations, maybe more imaging.
Okay.
If you want to come through though in the meantime, I thought I'd bring your husband through just to keep you company at least whilst we're doing all our bits and pieces. All right, so I'll be back with you later.
You okay?
Yeah, I'm okay. They've got to do more tests, haven't they?
Yeah. It's good that it may not have been a stroke.
Yeah.
Paul and I have been married for 41 years. And I love him to this very day. But you have got to work at things. And that's why I think ours was so successful, because we worked at it. We didn't just give up when the first little bit went wrong. You know, we worked at it. We were a team, always a team.
Okay, so you're going to come in under our team, which is the stroke team. It's very difficult to know exactly, you know, what's on the scan. It looks like a little area which is a bit swollen, a bit more swollen than normal.
Is it serious?
I really don't know. But you'll be coming into hospital, we'll look after you, and we'll try and get you some answers.
Do you want to take off them socks?
You want these off?
Yeah, I think it'd be better if they were off.
In medicine, you will see things that you wouldn't necessarily choose to see. And watching people react to those things is very enlightening to the nature of people.
Please don't push nails.
I certainly do feel that the time we've got is precious, and so you try and make the most of it. You try and drink up that afternoon you've got with your family. We haven't got any work to do. You plan and you save for your retirement. You hope to live a long and happy and healthy life, and foregoing accidents or bad fortune, that's probably what will happen, but you just don't know.
Christine will be admitted to a specialist neurological ward where doctors will carry out further tests to examine the abnormalities revealed by her brain scan.
I'm not having England again because that's how I broke my arm. So I'm just going to have to choose for Ireland.
We know now to maybe just clap when England score. And no gymnastics, no cartwheels. But then the way England play, there's not much likelihood of any more cheering or cartwheels going on, so.
I was really worried for him. I just thought if he comes through this, he's not going to be the John he was.
I said to Paul, he was sitting down all day there with me. So I said to him, you go now. I said, everything is fine. And as soon as he went, this doctor came.
Okay, can you hear me okay, Christine? Yes, I can. That's lovely.
He said, it's not a stroke. And I thought, well, thank God for that.
First scan starting will last just over a minute.
And then he said to me, it's cancer. And I had nobody with me. We can't mend it, he said, but we can treat it. We asked him, like, how long it would be, and he said, people that have this live 12 months. So I just said to him, well, I'll have 24 then. So, you know, you have to be greedy in these things, don't you?
I never envisaged this at all. I thought we had another good 20-odd years together.
I've never been frightened of death, never. We all have to go sometime. Just that I'm going a little bit earlier than I thought.
That's when you really know when you love someone. When you realise how much you're going to miss her when she's gone.
Okay, Christine, we're all finished. Just coming into you. You've done really well there.
When she was a child, she had CB, and I say to her, remember when you was ill. If at that time someone could have come along to you and say what the rest of your life was going to be like, I'd say you'd snatch their hand off. You've got 3 successful children, you've got 4 lovely grandchildren. I know it's not a good innings, but there again, it's not a bad innings.
Some little kids out there haven't even had a life. At least I've had a life. I'm going to get every little inch out of it that I can, I'll tell you that much. I'm going to travel. And we have so many plans on different things to do that. And our first one is to go to Ireland tomorrow. And I'm going to eat plenty and drink plenty and, you know, be happy.
George's ED. Hit by a car, bullseyed the windscreen. Can I activate the helipad for a trauma?
In terms of the injury, you'd always know the pedestrians on the losing team.
Pulling out of a pram with a head injury.
She just said, I'm really sorry, it's not good news. What if he can't walk again?
We're at St George's Hospital in Tooting.
I thought we could lose her.